Hi, my name is Teresa Smith. I'm a physical therapist who specializes in pelvic health with Court Physical Therapy. This video is for people who are feeling nervous about their first visit to pelvic health therapy. You may have been referred directly to physical therapy or occupational therapy by your healthcare provider, or did your own research online or from a friend and decided to schedule an evaluation. Pelvic health therapy is a specialized area of OT and PT. We have completed additional training and have a special interest in treating dysfunctions of the pelvis. We can treat bowel, bladder, and sexual dysfunction, as well as pain anywhere in or near the pelvis, which includes the low back, hip, and sacroiliac joints. On your first visit, we will review your medical history and discuss your current symptoms. We want to know details like if what you eat or drink is affecting your bowel or bladder symptoms, or what type of activities aggravate your pelvic pain. You might be a little embarrassed to talk about these things, but just know that these concerns are common and it's important to discuss it in detail so that we can treat you effectively and efficiently. We will then do a musculoskeletal physical screen to determine if there are other contributing factors besides just the pelvic muscles. This may include checking your low back and hip range of motion, as well as your lower body and trunk strength. You may also be feeling nervous about an internal pelvic floor muscle evaluation. This involves palpating the muscles from the inside by inserting one finger inside the vagina or rectum to check the coordination, tone, and strength of these muscles. This helps us set up a plan of care that can get you better faster because we can target the muscles more accurately and prescribe the most beneficial exercises based on this information. An internal evaluation is not a requirement for pelvic floor physical therapy. It is optional, and some people may elect to have external assessments and treatments only. You can discuss any concerns with your therapist. We can treat a variety of conditions related to bladder dysfunction, including overactive bladder, urinary leakage, and bladder pain syndromes. We can treat bowel dysfunction, including constipation and stool leakage. We can treat chronic pelvic pain, including vulvodynia, levator ani syndrome, and dyspareunia. All ages and genders can benefit from pelvic floor physical therapy. In addition, low back, hip, and sacroiliac joint pain could be related to your pelvic muscles. If you've been attending traditional physical therapy without relief, you may try an evaluation of your pelvic muscles to determine if pelvic floor dysfunction may be playing a role in your other symptoms. You may have heard of Kegels. This is a contraction of the pelvic floor muscles. People sometimes think this will be the only thing we do in pelvic physical therapy. This may or may not be part of your treatment. In some conditions like pelvic pain, performing Kegels may make your symptoms worse. And if you have been doing Kegels without success, you may also benefit from pelvic floor physical therapy to ensure you are doing them correctly or to be prescribed different exercises. Pelvic floor physical therapy is so much more than just Kegels. We may show you stretches or other techniques for relaxation. You may also need some other hip and trunk strengthening exercises. We may use biofeedback to help you become more aware of your pelvic floor muscles. Biofeedback is a painless process that uses special sensors and a computer monitor to display information about muscle activity. This can help you gain better control of your pelvic floor muscles. We can also teach you how to manage your chronic pelvic pain symptoms long-term with tools and exercises that you can do on your own. Many of our patients respond quickly to therapy and notice improvements within 1 to 2 visits. Your results may vary, but the average number of visits is about 7 to 8. This number varies based on how long you have been dealing with your symptoms, the complexity of your condition, and your readiness to make lifestyle changes. No amount of leakage is normal under any circumstances, including pregnancy and aging. If you are having bowel or bladder leakage, or pelvic pain, or sexual dysfunction, I would encourage you to make an appointment today. It really can be life-changing.